Hi, my name is Greg Law with Laws of Motion Physical Therapy. Today we're going to go over some lunge variations. Now, lunge is a great exercise to learn to load a single leg, especially for people after an ankle injury, knee injury, hip or low back injury that have trouble trusting that leg. So if one person comes into a squat and they tend to shift over away from that left leg, they may not trust that left leg. So we need to teach that left leg how we want to load it or how to accept weight. The first and the most basic one is just a normal lunge. So you're going to stand stride stance. Most of the weight should be in this lead leg. So I'm going to keep my chest shifted forward, most of the weight into that left heel. And we're just going to drop down and push back up. Obviously, from this position, I can make it a little bit more challenging. Add in the weight in one hand or both hands just to load the leg more. Next is a curtsy lunge. So in this position, if I'm loading that left leg, I'm going to put a slider under my right foot, furniture slider. And I'm just going to come back, crossing this leg under and pushing back up. Next, if I want to work a little bit more on the adductor surface of this leg, I can shift my weight over. And now I have to use this leg to pull back in. I have I go down and back. And finally, another variation is a split squat. Thus, with a split squat, a great way to figure out where your feet should be, sit on the bench, put your feet out. This should be the distance that your foot is away from the bench. So I can come forward, bring this foot up, drop down. And obviously, just like we did with the first lunge, I can hold weight into this hand or both hands to increase the weight into this leg. And that's a great lunge sequence or a lunge variation to really challenge that standing leg.